So Affinity was basically built about 12 years ago. It's based on the premise, kind of what I went through with my injury. So about 12 years ago, I was paralyzed on the football field, and nobody really told me exactly what was wrong with me. So when we put the practice together, we said, okay, how can we put a practice together where people can know exactly what's wrong with them, and then if we can help them, and then how we can help them, and really kind of lay out a plan for them. So it's not something they just have to just go somewhere, get fixed, and have no responsibility. So we built the practice basically on that. So when people come in and they want to know, is there something you can do for me, or is there someplace else I can go? We've set the system up around that. And then most people that come in, they say, okay, I came in with neck pain, or I came in with back pain, or my elbow hurts, or my fingers are tingling, or I got headaches. And we do an evaluation on them, and we find out that's just a symptom of maybe something that was hidden or underlying. So we really want to kind of identify the real cause, and then get in there and fix that. And then from there, they want to get to weight loss, or they want to get into more health, or whatever they kind of want to shoot for goal-wise, lose body fat. We just kind of put together a care plan more custom tailored to them. Well, Affinity is unique, number one, just because it's got so much of what I've been through. It's got so much of what Dr. Mike has been through. It's got so much of what my staff, actually everybody who works here has some kind of a story that kind of attracted them to come in here and work here. So really the purpose of the practice is really just to do what we can to make somebody get where they want to be, whether it's out of pain or healthy or lose weight. But what makes us different, I think, more than anybody else, is that people feel that when they come in this office. They feel how much we care for them. They feel that we might not be able to want to help you, but we care enough to help you find someone that can. And that's really what separates us from other practices. The most common thing we do see is people come in because they're in pain. I mean, most people come in because either have neck pain or back pain, or they're stiff in the morning, or their energy is real low, or their posture is really bad. We see a lot of people with postural issues, especially with their computer age. For injuries, most of the time, people want to know is what's wrong with them. Exactly, is it a sprain, is it a strain, is it a disc problem? We want to diagnose that first and find out where the actual cause of the problem is, and then from there we'll put together a care plan for it. But what we're seeing more and more now is we're seeing our patients getting younger and younger. Since now we've got all the kids who have got cell phones, they've got iPads, they're on their computer up to 8 to 10 hours a day, just in general. We're starting to see them going from that good posture, which we're trying to instill into the kids, and we're seeing much, much, much more of this. And in kids who are developing this poor posture can actually start to cause mid-thoracic or mid-back pain, hip problems, the growing pains in the joints. They seem to just skyrocket right now because the symmetry of the body is off. So the big thing we want to do with the kids is really check the symmetry, work on the posture, and then make sure the primary curves are all in place where they should be.